وبركاته. Alaikum salam wa rahmatullahi wa barakatuh. We give thanks to Allah subhanahu wa ta'ala for making us Muslims and for counting us to be part of this program. May Allah continue to be with us and accept it as act of ibadah. My bit this afternoon is just to give us some synopsis because the topic is a very broad one. So I'll try and summarize it to the best of my knowledge so that we can be able to understand it and pick one or two things. The common orthopedic conditions, there are so many. I'm not sure we can finish it if we start now. But what I will try to do is that I will divide it into two groups. Àwọn ètò ṣe pé a máa ń rí lọ́dọ̀ àwọn ọmọdé, àwọn orthopedic conditions tá à ń rí látọ̀dọ̀ àwọn ọmọdé, and those that are common with the adults or the elderly ones. Tàbá wò láti bẹ̀rẹ̀, I think I will be able to do justice to the topic. First and foremost, we need to understand that the conditions or the orthopedic conditions, àwọn nǹkan tó máa ń fà á, there are some we call congenital problems. Pé a bí ọmọ yẹn mọ́, that's congenital. And there are some we call developmental problems. Bọ́mọ bá ṣe ń dàgbà ni àwọn àìsàn yẹn máa yọjú. Then there are some we call acquired problems. Àwọn yẹn bóyá látàrí accident nǹkan yẹn máa ṣẹlẹ̀. So àwọn nǹkan tí ibi tí mo wò pé kí n pín sí nìyẹn so that I really understand it. Lára àwọn tí a máa ń rí tó ṣe pé wọ́n máa ń bí ọmọ tí mo pè ní congenital deformities. Òun náà ni pé lè bí ọkọ̀ sí ká ní pé kò ní apá àbí kò lẹ́sẹ̀. Sọ̀rọ̀ yẹn ṣe àwọn àmàlẹ́ pé ewu délé yìí o nílẹ̀ Yorùbá wá ní ilé ní kékeré kan ni ó máa ń rí ọbẹ̀. Pàápàá jùlọ a lè sọ pé nǹkan báyìí ló ń fà á. Most of the time ẹlòmíì àsopọ̀lẹ́ ọdún yìí máa bẹ̀rù ṣàtìmáta ẹ má lè lò lọ́wọ́ ẹlòmíì àyà gbogbo abúlé bàbá ṣe gbogbo òkùnkùn ní folic acid ní vitamin glucose ní gbogbo ẹ̀rọ lò ó lè ṣiṣẹ́ rẹ̀ tó ìyẹn ọlọ́run fi ń dá tó bá ti ṣẹlẹ̀ ó ti ṣẹlẹ̀. Wúù yẹn treatment nǹkan tí ọlọ́run ọba aláwọ̀ dá kò sí nǹkan tí dọ́kítọ̀ kankan fẹ́ ṣe o tí ọlọ́run bá ti fapá sí ní artificial aláwà tọ́lọ́run bá ti fẹsẹ̀ sí artificial ẹsẹ̀ lámàrá tó wù yẹn kò develop láti lo oyún ni kò sí nǹkan tí dọ́kítọ̀ kankan fẹ́ ṣe sí yẹn. Lára àwọn congenital problem tí ìwọ àkóṣe tó yé ó develop ó wà bẹ́ẹ̀ kò straight ó wà wọ́n yẹn bẹ́ẹ̀ ni àbí ẹsẹ̀ yẹn bẹ́ẹ̀. Tòwú yẹn sì ó sì lè ní àtúnṣe. A máa ń pè ọkàn ní club foot ẹsẹ̀ ọmọ orí ọdún náà báyìí orí ẹsẹ̀ yẹn wá bẹ́ẹ̀ ó káwé ní. Tòwú yẹn sì á lè lọ padà. We do serial manipulation and casting. A máa nà díẹ̀díẹ̀, a máa fi kí òkú sí ìyẹn wọ́pọ̀ lọ́dọ̀ wa. Ìyẹn nígbà ṣe ní kápá òun náà ní pé ẹsẹ̀ yẹn fọ̀ but kò constrict ní ó bẹ́ẹ̀. Àwọn ìrísí tàbí pé wọ́n máa ń fà yẹn ni pé wọ́n máa ń kọ́nà tó bá jẹ́ pé ọmọ tó jẹ́ first born. Èyí mo fi kí ọ̀fun jẹ nítorí mechanical issue kan tó jẹ́ pé ó jẹ́ twins ilé ọmọ yẹn ò wá gba àwọn ọmọ yẹn tó tí kan bá ti ká ọ̀gá àwọn méjèèjì ká bẹ́ẹ̀ yẹn òun máa ń fà kí ẹsẹ̀ yẹn náà ká. Tó bá jẹ́ ọkàn náà ni bí ọmọ yẹn tóbi ju ilé ọmọ lọ tó tó mọ́ bá ṣe wá ká ẹsẹ̀ yẹn nígbà tó pẹ́ ló máa ń fà lára àwọn nǹkan dá ìrísí darí ló máa ń fà àwọn nǹkan míì lọ́kàn tó ń fa pàápàá jùlọ àwọn ọmọ tó bá ní syndromic type tó wáyé pé yàtọ̀ sí pé ẹsẹ̀ yẹn ò nà ó tún wá ní congenital problem níbòmíì bóyá heart problem ni o àbó ní spine problem ọmọ mi wà bẹ́ẹ̀ heart ò develop spine ò develop ẹsẹ̀ náà ò develop tó wù yẹn treatment tọkùnrin máa ní kò ń ṣe orthopedic surgeon nìkan ló máa manage ọmọ yẹn ó máa involve other specialty so a máa pè ní multidisciplinary a máa pè specialty mi ẹ̀yin náà wá wò so irú àwọn ọmọ bẹ́ẹ̀ yẹn teaching hospital wọ́n ti máa manage wọn torí ìbẹ̀rẹ̀ ti máa rí gbogbo specialist yẹn tó máa manage àwọn ọmọ yẹn. ẹlẹ́ẹ̀kẹta nínú àwọn congenital problem mo ti sọ pé absent pé kò tiẹ̀ develop rárá ẹlẹ́ẹ̀kejì ó develop but bí ó pọ̀ pé èyí ni tí ọlọ́run lè lò wá sábàbí láti rí pé ó padà. ẹlẹ́ẹ̀kẹta òun náà ni developmental wọ́n mọ́ bá ṣe ń dàgbà sí àwọn kìíní yẹn ó máa yọ bíi bow leg k-leg lábá ṣe ya ọmọ ọdún méjì ni bàbá ẹ̀ ní bow leg òun náà ní bow leg àkàkún ọmọ ẹ̀ ń dàgbà lọ 7 years 8 years bow leg ẹ̀ ó increase àkàkún nítorí bàbá ẹ̀ náà ní bow leg ó ṣeé ṣe kó má jẹ́ pé nítorí bàbá ẹ̀ ní bow leg ó sì jẹ́ problem pé yẹ ká ti address látìgbà tó ti kéré láà address. a máa ń pè púpọ̀ ní wọn a máa ń pè kan ní blount disease a ń pè kan ní rickets ọmọ tí ò ní vitamin D dáadáa lára ẹsẹ̀ wọn kàn máa bend. torú yẹn tá a bá ti di pé ọmọ dá wo pé lápẹ́sẹ̀ yìí ò sí kò straight o there is some deformity around this knee then it is better we present to the hospital ẹ jẹ́ kí orthopedic surgeon kó jẹ́ kó ló máa sọ pé ẹ má wọ̀ ọ́ normal ju ká fojú fò lọ. èyí tó tún máa ń gbé kàyéfì náà ni pé a máa ń sọ pé wọ́n á mú ọmọ lọ traditional bone center wọ́n á ní kọ́ lọ bá wọn tó wọ́n máa ti wá gbá ọmọ yẹn níbẹ̀ wọ́n á wá ba ẹsẹ̀ yẹn jẹ́ á wá di pé ẹsẹ̀ ń dúdú ó di gangrene ó wá di pé nǹkan tí wọ́n á sọ pé wọ́n fẹ́ gé. So we have to be very careful. Once we notice that as this child is growing, the legs are not straight, maybe they are crooked, also bent, above nicky leg, ejake present, so that we are able to run the necessary test. At least of okay, eléyìí ò normal, eléyìí ò normal, nǹkan báyìí ló fà á. Alẹ́ lè sọ pé ẹ bẹ̀rẹ̀ sí lóògùn báyìí àbí ó máa nílò operation ètò bá nílò operation á sọ fún yín á lè ṣe surgery láti correct deformity yẹn. ẹlẹ́kẹ̀ẹ́ bẹ́ẹ̀ òun ni acquired yàtọ̀ sí developmental fọ́mọ bá ṣe ń dàgbà eléyìí bóyá accident tó tá bá yẹ àwọn ọmọ tó ń ṣe ní káàkiri gbàgbà so they are prone to having fractures. So tó bá ti dá lọ́wọ́ yẹn àbí ọ́ndálẹ́sẹ̀ we should not go to traditional bone center àyè pé mo tẹnu mọ́ torí púpọ̀ ọdún àwọn cases tá à ń rí wọ́n á ti kọ́kọ́ lọ sọ́dọ̀ àwọn traditional bone centers and once they are mismanaged they will now revert back to igbobi. So we need to be very careful once they have any fractures it is better they present to the hospital and x-ray is the minimum test all that is kọ́kọ́ ṣe x-ray now and once you do the x-ray you will be able to say okay there is a fracture or not. What type of fracture? Is it the one that can be managed with POP or is it the one that can be managed with? So I have to be very careful. Once we have fractures, let us present to the hospital so that they can be truly managed as at well due. No matter what the traditional yẹn, nàjẹ́ bá ń gbé wọn padà bọ̀ yẹn, it's already complicated. Sometimes they have infection. And when there is a fluid infection, it's a life-changing
orthopedic condition. So we don't want infection, we don't want gangrene. Ẹsẹ̀ yẹn lè ti bàjẹ́, ọ̀kọ́wọ́ yẹn ti bàjẹ́ kó di pé wọ́n á sọ pé wọ́n máa gé ni o. So we need to be very careful with that. Èyí tí mo fẹ́ fi parí ti àwọn ọmọdé, òun náà là ń pè ní tumor, which we call cancer. We also see those ones. Kò ń ṣe àgbàlagbà nìkan ló ní cancer, ọmọdé náà ní cancer. They are bone tumors and usually common around the adolescent age. 13, 14, 15, that's age bracket. We have some common tumors in that age bracket, which we call osteosarcoma. And those tumors are very deadly. So tá bá ti rí pé ọwọ́ ọmọ yẹn ń wú, ó jẹ́ ń dùn, àmọ́ ọmọ yẹn ń complain pé apá yìí ń dùn mí. 1 month, 2 months, also do bone pain. It's better we present to the hospital so that they can do the necessary tests, X-ray, àbí some advanced tests like MRI or CT scan. So one thing we should know about tumor is that the symptoms are persistent. Unlike some other conditions, people yẹn máa wọ tó bá yá sí àrùn padà wá. But in tumors, the pain is constant. Tó bá ti bẹ̀rẹ̀, ó ti bẹ̀rẹ̀ nìyẹn. Can be there for months and it keep increasing in intensity. Ó máa pọ̀ sí ni. And usually worse at night. And then the pain yẹn máa pọ̀ sí, so ẹ̀ ní sùn. So once we have that, it's usually accompanied by swelling. Ibẹ̀ yẹn lè wá máa wú. Loss of appetite. Kò ní lè jẹun dáadáa. Then lean. Weight loss will be there. So once we start seeing all these symptoms, we need to present to the hospital for adequate assessment and treatment. So that's very important. Lastly, on orthopedic conditions in children, àwọn ọmọ tó jẹ́ sickle cell disorders. We also have the sickle cell disorders and orthopedic conditions. There are so many. The reason why I have to add this is that this is preventable. Unlike some other orthopedic conditions, tí a ní kápá lé lórí, but this one is preventable. So once the couple tábà ti lè ṣe genotype wa, bóyá AS ni wá ọkọ náà AS, ìyàwó AS, it's at that level we can prevent it. Tí a bá ti fẹ́ra one level yẹn, a ti avoid the sickle cell disorder. But a bá wò pé ọlọ́run ọba náà ni ló ń protect wa and aburú ta rí ta rò pé yẹ ká sáfún ká fẹ́ra wa. Ọlọ́run lè ṣe kádàrá pé yẹ kó ọmọ tó máa bí ó máa jẹ́ sickle cell disorder. And we begin to nurse a lifelong problem. And one of it is what we call osteomyelitis infection. Bone infection is common with them. They also have what we call avascular necrosis of the femoral head.
So usually what we have that is at least the most regular check-up of all these medical conditions, diabetes. Some of them actually have glaucoma, they can't see well. So once they are told they can't see well, they are just thrown out. Yaba risk of fall. So we also need to take care of all these conditions. So far related to orthopedic condition. So we palliative, some other things like tumor, which we see in elderly patients or individuals. Every condition only with cancer or tumor in another part of the body that will now come and affect the bone. Basically, prostate cancer. So no condition for the body. Only the prostate left over the only the bone pain and also need to platform. But I want to go on that. For now, my favorite job. So, I'm actually trying to summarize the topic, looking at it from the children, the common community conditions in them, looking at it from the young adults perspective and the very elderly one. Kí àkíyèsí àwọn ọmọ tí a padà sọ, there are so many things, but I think if we have questions, then that can also make my lecture a bit interactive. Assalamu alaikum warahmatullahi wabarakatuh.